Hip replacement, the operation. Hi, I'm Dr. Larry Johnson of Merrimack Valley Orthopedic Associates in North Chelmsford, Massachusetts, and I operate at Lowell General Hospital. I'm an orthopedic surgeon who's been board certified for 30 years. One of my favorite operations is doing the hip replacement because it's such a successful operation. Over 600,000 people a year are receiving this operation. So basically a hip replacement operation is performed by resurfacing the socket of the pelvis and putting in a new femoral component of a diseased femoral head. So basically what we're doing is putting a socket in, which on the outer surface is titanium, which goes into the socket, and bone loves to grow onto titanium. We also have these holes here where we get immediate fixation by putting in a couple of screws to fix it. Then in the liner of the socket we have high density polyethylene or ceramic sometimes in order to resurface the hip. Into that goes a femoral head, which is nice and round, perfectly round like your hip should be, but usually isn't by the time you need the hip operation, and that rotates in here. This is affixed, that is secured to the femoral component, which goes into the thigh bone, the femur. We have a lot of different sizes of people, so we use a different size of prosthesis, the right one for you. So we put this on and we find out making sure that it fits just right. If it doesn't, we may change the head size up or down a millimeter or two, or the size of the prosthesis up or down a millimeter or two. Once we get this all together, we check for the stability of the hip to make sure it's not popping out or dislocating. If that's the case, sometimes we lengthen the neck a little bit. Post-operatively, we use hip precautions so the patient does not dislocate their hip. We also give antibiotics to prevent infection, as well as aspirin or other blood thinners to help prevent infection. The hip replacement operation is a wonderful operation for people suffering from severe hip pain due to arthritis, avascular necrosis, or post-traumatic arthritis or other conditions. If you're interested in learning more about this with me, please call me at Merrimack Valley Orthopedics. The phone number there is 978-275-9650. I'm Dr. Larry Johnson. I'll be glad to help you.